Hello and welcome to the OUM webinar on the standard pathway. So lovely to see you, Bernard and Bruna and Anthony and Henry and Gijo. And talofa to you, Matthew and Romani and Jordanos and Zara. Kia ora to Hayden and Henry. Hi to anyone joining us via recording. We're so happy you're here, Stephen and Olu and Sam and Kanisha. And to those of you who are joining us a little later on today, I am Dr. Nicolette McGuire. And if we haven't met before, I am OUM's Associate Dean for Student Engagement, and I'm your trusty host of all our informational webinars. So we're so glad that you took some time out of your day today to be with us. Our special guest today is Dr. Ahmed Musin, who is our Dean for North America and Australia, and who will be talking with us today and answering some questions about our standard pathway. So if you have questions throughout the webinar, please feel free to use the Q&A box and we will try and answer those live. Anything that we can't get to today, we'll pass back along to our admissions team and they'll be happy to get back to you. So let's get started, shall we? Dr. Ahmed, would you like to introduce yourself to our attendees today?
Thank you, Dr. McGuire, and greetings to everyone joining us today and anyone who will be watching the recording. I'm Dr. Musin. I'm the Dean for Australia and North America. Just a little background. I've been a physician since 2003. Practice medicine in Middle East, in Australia and North America. I joined OUM in 2017. I went through different stages from as a faculty, teaching faculty, as an advisor, heading the student services department, leading the Department of Research, and here I am as the dean for Australia and North America. As you will hear from me a lot today, it's been a journey here, and it's amazing to be working in this virtual university. I think I'll leave it with that, Dr. McGuire. I know there will be questions about those, so leave it with that.
I just love that you are like a global physician. You've really had experiences practicing in many different areas of the world, but also in many different types of practice, like from rural, remote to urban. And that you've had a lot of different experiences as an educator as well. So you've been teaching for quite a number of years. You ran our research program, and now you've really hit the ground running as our dean for North America and Australia, which is a huge undertaking. So my first question to you is there anything that you cannot do?
At OUM, no.
All right, well, let's roll it back a little bit. So tell us why you decided to become a doctor, because it's not an easy undertaking to, go through an undergraduate degree and then complete an MD and then, all of the things that you've just mentioned to become the kind of physician that you are today. So, why did little Ahmed want to become a doctor? When did that kind of first pop into your head?
That exactly was the case. It was a little Ahmed at that time. So that was back in the middle school when we start getting those lectures and classes in human body and health. And I really got fascinated on how our body systems work. I mean, when you think about it, how this integration and homeostasis and maintaining certain levels of all electrolytes and the cells will require a really a really controlled environment in order to work, and how cells from the thyroid work with the pancreas and how those will affect the heart. I mean, when you think about the body, it's really fascinating. And the more you go in depth and learn about it, you just really get attracted. And that's what happened to me. The more I was studying in middle school and high school, and I saw all these things that I wanted to learn more and more and more. And that's really what brought me into starting medical school. Not only that, what I like, I also, I mean, I remember one of the first aid sessions that we got, and it was a real scenario where we were helping and assisting people, or injured people during accident in my city. That's when you see you can have an impact directly on, you can turn tears into a smile. And that really stayed with me. Like I know this is the thing that I want to do. So that's my little story, how I got attracted into medicine. Now, into how I'm practicing in different scenarios. And I'm maybe one of the few physicians who are ECFMG certified. I mean, I covered the USMLE pathway as well as AMC pathway. This is the, depending on your where you're going to practice, the jurisdictions, you'll be required to do some licensure exams. And that's how I covered both systems, or both pathways. And at this, I mean, one after one, definitely one it needed. But the good thing is, okay, there is a huge overlap, so it's not tough for anyone who, if you finish your USMLE or your AMC, you can try and discover different pathways. Medicine, the heart is heart, whether it's in Australia, Canada, here, pretty much the same heart. It's same physiology. All we share all the same structure. So it will not be tough. It's just kind of, sometimes there are the exam taking strategies that differ from one place to other, but in general, the knowledge and the foundation is pretty much the same.
I really like what you said about turning tears into a smile.
Yeah.
That was really nice. And we are going to talk a little bit more today about these pathways to licensure in Australia versus pathways to licensure in North America, where we were talking a little bit about ECFMG, AMC, USMLE, those lovely acronyms. And for those of you who are interested in practice in North America, we do have a separate webinar where we go into a little bit more detail about that. So I encourage you to find that on our YouTube channel, or you can reach out to the admissions counselor for that, because we're going to focus a little bit more on the standard pathway today, which is the pathway that our students who are in Australia, New Zealand, and Samoa take. That's that AMC part of the pathway that Dr. Moosen was talking about. So how did you, with all these experiences, how did you come to be an educator and dean at OUM? What drew you to the university and to this community?
Perfect question. So after my 4 years practicing in Australia, I saw myself really attracted into research and to academia. So that was the first part. Starting with my master's in public health in 2014 till 2016, and then starting my master of science in immunology and cancer immunology at MD Anderson here in Houston, Texas. That's when I learned about OUM. And what really attracted me is I was taking online classes and during my master's of public health, and I know it worked. And been working for years, and this is not now. I mean, this is back in 2010, 2011. There were starting seeing a lot of online classes. I remember with two or three of my professors who were teaching me classes at that time. They're giving us classes from California and from Vancouver, and it went really well. we are assessed and in the same way as anyone who's sitting in a classroom, but the added flexibility where I can sit in my home and get classes and do all my assessments. It was really great. And when I heard about OEM offering the same thing, and now for medical students, I was really fascinated by the idea, and I really supported having giving other, because I know a lot of students, a lot of people who really wish they have an opportunity to study medicine, but due to unforeseen causes and personal issues and other commitments, they couldn't do it. And sometimes in some part of the world, either you do it at age of 22 or you cannot do it. Simply, that's the story. So we are offering an a platform where everyone, regardless of age, regardless where they live, are able to do medicine, the thing that they love the most, really attracted me, and that's how I moved into more from the academia that I started in with my masters and into PhDs, and now I'm a research fellow here. Into From practicing in a rural, remote area and like some 400 kilometers in west of Sydney into academia. It's a move, but I'm enjoying it the most.
Um, it's just interesting because you just take an opportunity and you're like, I really want to do this. I'm really interested in this. And that's not separate from like what it's like being in medical school or becoming a doctor. You are a lifelong learner and you have these opportunities to go into practice and help patients. But then you also have opportunities for additional careers on top of that, right? You know, if you end up really being interested in research, you have the opportunity to do so or to go into academia. So I'm really, really happy that your career path put you in that direction so that we could be colleagues, but that you also had those good experiences
Thank you.
as a clinician too. And I think it's interesting too that you kind of mentioned how the online curriculum sort of drew you to OUM, and that's what draws a lot of our students to it, that we really offer the chance, no matter what your age is or where you happen to live or what your personal circumstances are, that having online classes for the first couple of years really allows people to pursue medicine that wouldn't otherwise, even though they have the talent, even though they have the smarts, even though they have the drive, it's just not possible for various reasons. So and you've been here since 2017. So, in your experience, like how have you found that students and community members of OUM are different from medical students elsewhere?
Excellent question. So I think the what I could tell you that other students sometimes are jealous, given the flexibility that OUM students have. That's maybe the one of the superior activities or superior characteristics that our students will have during their journey here. But in general, what I've found is I think our students have a balanced life. They come with their own education background. Um, they are more mature. Um, Sometimes they come with other commitments, life commitments, family commitments. Um, Sometimes they're just switching paths and I mean, I'm sure you met with you meet with all the students, so we have dentists, we have pharmacists, we have very big lawyers in certain cities, and they decided, no, this is time for medicine, and they're leaving everything behind and moving here. I think these are the kind of major differences. Uh, what is really, I think, important, and I think most of our students what we're showing is they really have a great balance of other commitments compared to, like, my daughter is not in medical school, but in 22 years or 21 years, and she's not good at balancing time or other commitments. But now for our students, they have a like really good time management, balancing other responsibilities, whether family, work. Um, there is a lot of on their plate as well. That's normal for all medical students, but maybe I would say OEM students will have more given they're like coming with more mature or older a little bit. They will have more commitments for family, but it's they're already with the support systems and that your team is leading. And I think all our students are regardless of whether their other commitment, they've been very successful, and we have proof on ground. We have entrants or practicing in pretty much every state in Australia. We have junior and senior medical officers. We have registrars. So they are doing great. They are doing great. It's and medical school is stressful, but it's fun. It's require a lot of dedication. I mean, a human. The last thing that you want to do a mistake is when you're treating a patient. So it's the only thing that we have is we our knowledge. That's pretty much the arsenal that we use. And so it's I think one of the more very important attribute of medical students in medicine in general is the keen to learn and the continuous education. Um, I don't think that will be applied pretty much the same for engineering or other branches. But now, when you're on medicine, you need to stay updated on a weekly basis, and I'm not joking about weekly basis.
It's funny that you mentioned fun, that it's fun, because I am teaching our medical sciences reproduction course right now, which is one of the preclinical courses. So it's all online. I'm here located in Canada, and I was speaking to one of my students who is in Sydney, and she was saying that she was looking forward to the exam coming up, that she was going to have a lot of fun with it, and she was like thinking about how she was going to have fun in her exam. And I was like, yes, these are our medical students, but they do like our students have lives, and we recognize that they have lives, right? Like medical school is not the only thing that's happening in their life. And so we have to treat all of our students as like individuals and meet them where they happen to be at and honor the experiences that we have. One of the things that I love about, maybe you like this too, about being in OUM classrooms is that, yeah, we have people who have nursing degrees and are paramedics. And then we have lawyers and engineers and teachers and professors that are all here as students, bringing in different perspectives that come from their life experience and also come from their professional experience. So it really creates like discussions and different ways of looking at the problem. Like I love when I'll have like an engineer in the classroom and like a paramedic and a teacher, and they're talking about a particular problem. They're all looking at it from a different side. So then they get the full picture. So this is where I'm like, oh, this is really fun for me. That's what I
The
like,
other
where I have fun in medical
I,
school.
I totally agree. The other diversity that I think a lot of students are enjoying as well is having students who come like from different states in Australia, along with their colleagues from the different states in the US, and then students from Samoa and few from Europe. And it's when you think about it, it's just you have classmates, or you're gonna build up friends in different continents, and that's really great. And that's sometimes I enjoy the live discussion about the guidelines for disease X in US versus Australia versus Samoa, depending on their own kind of skills or the availability of diagnostic imaging differences in and how insurance pay. All these will be part of the discussion. So it's very 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 live sessions that students are getting into.
Okay, well, let's talk a little bit about those areas that we serve at OUM. So, at OUM, we serve students from 5 different jurisdictions. So, we have students in Australia, New Zealand, Samoa, US, including American Samoa, and Canada. So, all of our students who are in Samoa, Australia, and Aotearoa, New Zealand are on our standard pathway. But they have a different set of requirements than our students who are in North America. So when Dr. Moosen and I were speaking about being in classrooms, you are actually in your online classrooms with the students from all 5 jurisdictions, but those that are on the standard pathway have a slightly different set of requirements than those who are practicing or who are planning for practice in North America. So for those of you who are joining us today from either Australia, Aotearoa, New Zealand, or Samoa, you may have some various questions about what your requirements are on your pathway. And we're going to start talking a little bit about the curriculum and moving through OUM along the standard pathway. So we're going to start kind of from the very first part, which is the stage that many of you may be at right now, which is that you're either have applied and maybe you're in interview season right now. Or you may be thinking of applying to the next intake, or maybe you're just still kind of thinking about entering medical school at some time soon in the future. So a common question that students have at this stage is like, are there any main science courses? Are there any prerequisites that people have to take before they enter the standard pathway at OUM? So Dr. Moosen, are there any prerequisites that students like must have before application? Are there any areas of science or science courses that you would recommend for students to sort of strengthen their application, but also to improve their ability to kind of handle the coursework once they do get into medical school?
So as a prerequisite, there are none prerequisites. It's more here about recommendation in for lab. So all students will come with bachelor degrees and they have their educational background that will be verified during the admission process. But as a suggestion or as a recommendation, definitely if you are not familiar with what is a cell, what is biology, and with the assumption that just like you come in for example, with the background of engineering, and you never heard about a cell, which I don't think so. That's not the case. Everyone will learn a little bit about the cell and some stages of their education, but definitely biomedical sciences, biology, pathology, physiology are good start. If you have few months to study before, or you can enroll in any classes, maybe the local universities, local colleges, just to learn a little bit about the human anatomy. I think that will be very useful. It will save you a ton of time. Now, this is only a recommendation. We will still teach those. But let me tell you what will be the difference. Instead of spending 5 hours during your regular week at OEM because you studied those before, and or you're coming with a solid background in health, you will spend 20 hours studying those materials. So yes, it will. It's just we're trying to get up with ways that we can save you time in during this period. So definitely human anatomy, physiology will be on the top of the list. Genetics, immunology, I think those are a really important topic. And when I said the like as an introductory courses, I'm not asking you to finish a PhD in immunology. No. So simply an introduction, what is the like what's the anatomy, what are terminology that is being used, how physiology, simple physiology as an introductory. I'm not expecting you to know everything about cardiovascular system or the reproductive system at this stage. It's just like You don't need to spend time to learn those medical terminology. You don't need to know what is a pathway, positive or negative reinforcement. All these things are part of the knowledge that you will, yeah, that you can definitely gain before you start your classes. So that will be my recommendation for anyone who's doesn't have that kind of background. Other than that, if you're coming with a background in nursing and or pharmacist or dentist or physician assistant, any sort of healthcare provider, I'm sure you will have enough background to get you running during your first class in general principle.
Any advice for students who don't have a healthcare background other than any classes that they should take? Do you have any advice? Because we do have some students that come from healthcare backgrounds, like you mentioned, paramedics, nurses, and then we have students who come from outside those fields. And we've even had questions in the past like, can I apply if I'm outside healthcare fields? Absolutely, you can. And you're not at any disadvantage if you don't have a healthcare background, other than knowing some of the basics, some of the terms, having a general understanding of some of the topics that Dr. Musa just talked about. But is there any advice that you would have from people who don't have any work experience in the healthcare field?
Uh, it's doable. That's the most important thing. We have successful physicians here that were coming with as a lawyer. They didn't do anything. They were like they have no experience at all. It required commitment. You need to be keen to learn. It will take time. So as I said, I think I brought this into this idea of you sometimes in terms of comparison, I wouldn't compare myself to a nurse practitioner who can finish maybe this assignment in an hour. I will say for another extra hour or so. As long as you're keen to learn, you do the assignments on time, you will have the support of the course director, unit directors, and instructors. You will be able to do those. Again, as a recommendation, once you decide, maybe you can start from now looking into just Google and Google heart, Google those human organs and see, do you feel attracted to learn about those, or it's scary? I can tell you, if you go look into the brain, I will run away. So don't don't select the brain. Look at some organs that are yeah, very maybe easy to understand: heart, lungs. Some that are closely related to your high school, undergrad training. Even I know friends of like undergrad engineering are still studying some human biology. Learn about those systems and see how you're interacting. Are you able to recall some facts, some concepts? If not, you can see. I mean, I think the online and this online life is making or life much easier right now. I mean, you can look at references. The references are available everywhere, and really easy to get a sense of what you should expect as a medical student. But definitely, I think the biomedical core biosciences, biology, histology, human anatomy, as an introductory courses will be very helpful for students with no healthcare background.
Uh, I see heart and cardiovascular system and I want to run away. Endocrine system, I'm running towards that. So it's funny that you're like, well, I'll have a system that we're like, but sometimes fear is like a really powerful motivator. Like I've, had to teach stuff in the cardiovascular system. So I had to learn, teach myself that, learn that. So I think it's like, you've got to be really passionate, motivated to learn these kinds of things, and also be really resilient in the face of fear. Like use that as a motivator.
Oh yeah.
Use when you don't do as well on something as you normally would. Like, are you someone that just won't do that again? And you'll just shy away from that and avoid it forever? Or are you like, oh, I'm going to really get it next time? Like, I'm going to just keep moving forward. So, those are the kinds of behaviors that really help push you forward in medical school. So, it's a marathon for sure.
It is.
Should people expect like life changes, schedule changes, changes to how they spend their time, what their commitments are once they get into medical school? Because we know our students like have lives, but should they expect any changes to that? Or are most people able, because we have an online program, it's just easy to kind of do everything that you once did, but now you just do that, sleep a few less hours?
Perfect question. So medical school is a commitment. So at the end, we all have a 1 week, we have 7 days, 24 hours. So when you have when you have a title of medical student, that means you will spend a lot of hours studying. Again, I think I mentioned that you're dealing with lives, and it's not something like you can just think, okay, I'll just get a pass and move on. Now, you need to master and excel in every system that you will study during your preclinical, your clinical phases. So in terms of changes, yes, there should be changes. There should be an integration somehow of 40 plus hours that covers your study time, your lecture times, your interaction, your communication with colleagues, your study groups. 40 hours is 40 hours, and sometimes students will say, well, I'll just do 40 hours study and I will keep my other 40 hours commitment. uh, you can't. Trust me, something that has been discussed for years, and you can see the literature. Simply, the brain will. You can do that for 2 days, 3 days, yes, or I mean, let's go 2, 3 weeks. Yes, that's fine, but you don't do that for a whole 4 or 5 years. And so, yes, there will be changes. You need to have the student, if one is working full time or 40 to 60 hours, they can't do that work anymore. Um, 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 they need to cut. We're not saying like you need to cancel everything and just focus on your or study, even though it's think about it as an investment. You're investing resources here in in medical study. It's not only the other type of resources, but think about your time as a very important resource as well. So definitely in terms of commitment, there will be much more toward your toward or how you're gonna manage these commitments, whether life, work, family, other responsibility, business. A lot of our students come with they have some sort of business that they need to take care of. Now you have medical studies. I can assure you that this is, even though we are giving you the flexibility, but there will be no easy pass. We are preparing the students to get through AMC, and AMC, you can go online. I'm not going to tell you about how it's not a joke, for sure. It will require like the students who did really well during their clinical years and know medicine, really know medicine, because and again, think about it, like, do you want to go to a doctor who doesn't know or has limited knowledge? Personally, I won't. And I'm sure everyone here in the session will be the same answer. When you think about that, you want to be the best doctor in your specialty, and this will require a lot of knowledge. Knowledge cannot be you cannot drink it, you cannot eat it. It needs to be studied. So you will need to spend time with study. Now, the good thing is with different tools, um, we can have a smart studying these days. It's like we can, instead of spending maybe looking for answers for hours or days as we used to do, now you can get an answer quickly through different systems that are available, but it's still that require you to do the job. That's why it's more an active learning, and active learning is much more important because that will lead to long-term consolidation of the knowledge, not like the passive learning that you can learn for this coming quiz and you forget about it in 1 week from now. So there will be a lot. There will be a lot so I mean, coming back to your question, Dr. McGuire, yes, there will be definitely. If you want to be a medical student, you need to have that in your mind, and that's how you're gonna plan your coming 4 or 5 years.
There's no shortcuts in medicine.
Nope, unfortunately.
All right, well, let's talk about like how long you got to have those 40 hours and sustain that level of concentration and study. So can you tell us a little bit about how OUM has like a preclinical phase and then a transition phase and clinical phases of the program? So what can you give us some basic information about those phases in the standard pathway and about how long the standard pathway takes to complete?
Sure. So in general, the standard pathway is divided, as you mentioned, Dr. McGuire. You can think about it as three different phases. We're looking at a preclinical phase, which is roughly 2 years, two plus. I think it's to be exact, it's 78 weeks of knowledge of classes, and there are a few breaks between units, and then we have 32 weeks in the clinical transitional unit, and then we have um, a total of 72 weeks for clinical rotation, and that will be divided between core 56 weeks of core rotations and 16 weeks of elective rotations. Uh, During the preclinical phase, we will learn the foundation of all the systems, so foundational sciences. It's really important. It's sometimes students say, can we jump into internal medicine? And you cannot really jump into internal medicine. You need to know what is the heart, how does the heart work, what are the things that affect the heart, and then you will learn these preclinical sciences during the clinical years. That's when you're going to apply your knowledge. So it's more an application of what you're learning in the first 2.5 years. So the preclinical curriculum covers the major medical sciences, looking at anatomy, physiology, pathology, pharmacology, microbiology, biochemistry. I'm missing something?
Genetics.
Genetics, yeah, yeah. So all those are and the way that the our curriculum work is, uh, you will have a general principles unit. That's the start, and during that phase, it's an 8-week unit that you will learn an introduction into each of those. So what is genetics, what is immunology, what is biochemistry, what is histology. It's more as a medical terminology, and really giving you some heads up what you're going to see in these systems. Then what we will see in the other units for the other 2 years, it will be 9 different systems. There are differences in the length, but it cover organ system. So you'll have cardiovascular, urinary, pulmonary, reproductive, neuroscience. So it will be divided into 9 different systems, and you will spend time learning everything about these systems. And when I say everything, I meant it. You will cover the normal processes of these systems, and then you will have some sort of clinical integration. So if you're missing this kind of hormone or enzyme, what is the kind of clinical presentation that you will be seeing? It will not be to the depth of internal medicine or other or what you're going to see in during your clinical rotations, but it will really give you the knowledge and foundation that when you go to general medicine, you won't be surprised by that. Or diabetes is related to insulin deficiency, for example. So you will know what is diabetes and how insulin and what is insulin, how insulin work, and why we're seeing these kind of symptoms and why we see polyuria with diabetes and all that kind of stuff. So it will, in other words, you will be able to understand why this patient is presenting this way. You need to, if you want to be a successful physician, you need to learn why. It's always the word why, and you cannot always think about why without having the knowledge in the normal processes that cover, as I said, the anatomy, physiology, and all other aspects. So that's what you're going to spend for the first 2.5 years, less than 2.5 years. Then you're in the clinical transitional unit, just as what the term says here. Here you'll learn more on how you're going to apply what you learned in the first 2 years into clinical scenarios, and you will have an introduction to the core rotations, and you'll learn more about behavioral science, and you'll some statistic classes, and there will be several assessments throughout the way, and then the final week in your clinical transitional unit is what we call the in-person week, where you will have hands-on physical examination, learn some techniques, suturing, cannulation, injection. You will learn about some maneuvers, how are you gonna do, how are you gonna perform cardiovascular examination, how are you gonna perform other system examination. You will learn an introduction into imaging, what is an ECG, how are you gonna read an ECG, even though that's something that you will learn during your cardiovascular unit, but you will still learn more. You will have more enhanced in-person kind of guidance on all these, and by that time, once you finish your CTUs, that's when you're going to move into your clinical rotations. Clinical rotations will also be divided into core rotations, cover the core specialties: internal medicine, surgery, peds, OB/GYN, and psychiatry, emergency medicine. I think I covered them all. Then you have your elective rotation, which is really up to you. Definitely whatever you like. It's open. Keep in mind that students will be required to do a 4 week rotation in Samoa, and many students enjoy those hands-on experience, and they can do electives or co-rotation depend on what they enjoy or what they are missing. Uh,
I would only
I,
say all students enjoy their time in Samoa.
yeah, exactly.
It's a really good hands-on experience where just the clinical exposure that you get and what you're able to do in terms of patient contact and hands-on
Exactly.
is really, really good. I mean, I would say the favorites for students is the OBS and gynae because they get to deliver babies, and the psychiatry is a really
Yeah,
popular
exactly.
active there as well, but our students really enjoy it. And all students have to complete 4 weeks, but students are able to have longer time in Samoa for rotation if they wish to.
I
So,
just received
oh,
a
sorry, go ahead.
request from a request from a student who said, like, so they were like they have 8 weeks, and they said they want to extend it for another 8 weeks because they're saying like it's just amazing how much and they're doing like OB/GYN, and they're looking for another surgery rotation there. So it's students are going there, and especially as Australian students are spending very good time there, learning a lot, and I think it's really a really great experience for everyone to stop by there.
It's very cool too because when you're in Samoa, like you might be coming from Australia, and then will have North American students who are doing their rotation in Samoa at the same time. So you get to like meet in person. And then you'll have Samoan students from OUM, but also from NUS. And then we have students coming to do international rotations from other countries and other universities as well. So it's a real interesting experience. And sometimes students ask, like, is there cultural and like language barriers? They do have Samoan is spoken in Samoa, but the clinicians who teach you speak both Samoan and English. So you'll actually get an opportunity to like learn some Samoan so you can interact with patients, although most individuals do speak English as well. So it's a really interesting opportunity. Our students always kind of come back just grateful for the opportunity to be able to have their learning enhanced in their mind, open a little bit to how things are done in different areas by different people. So where do Australian students do the rest of their rotations? If they have got 72 weeks to do rotations, where do they typically do rotations?
Oh, everywhere. So we have a network of hospitals, public, private, and even depending on, for example, if you're doing general practice or family medicine, as we call it, they're gonna do it by in the clinics, and they do it that we have a network of hospitals in every single state. And even the first point that I heard, like we have 2 or 3 students doing some 1,500 kilometers north of Perth. I don't know if you're aware of, it's a huge estate, Dr. Maguire, Western Australia, and there was a small tip that I was surprised that our students there were able to secure rotation in a close proximity. So we have a network of practices everywhere, including Tasmania. Students are doing their rotation in all the core and doing electives. And again, the setting, hospital setting, which include both public and private setting, as well as private clinics. So I don't see any challenges there. Students are getting most of the students, cannot say 100%, but most of the students are doing that within their city, or at least within their state.
Yeah, we do. We do encourage students when they're planning for rotations to plan to travel to different states within Australia to get spots kind of close together, so you don't have large gaps between rotations, or just so you can kind of make sure that you're getting everything that you need. So that is something that we recommend when people are planning for that. And then sometimes people are a little bit curious about costs related with clinical rotations. Our clinical rotations do have classes that go along with them that are OUM sponsored, and then you also have a clinical supervisor on rotation. And we had our webinar last week was with our Chief Financial Officer, Ms. Susie Robertson, and we talked a little bit about costs associated with clinical rotations. So if you missed that webinar, or you want to know a little bit more about that, please go ahead and look for that on the YouTube channel, or you can reach out to the admissions council, and I'd be happy to provide you with that link. Anthony wanted to know, can students complete any units earlier than the proposed time? So you said there was 78 weeks for preclinicals, and up to 32 weeks for clinical transition, and then 72 weeks for the clinical rotation. So can students complete any of those a little earlier? And this is a pretty common question that we have. Students always want to try to get things done as efficiently as possible.
Uh, Unfortunately, no. And the reason for the no is we tried it before. Students were not able to handle the load. So the only way that I'm assuming the question is coming from is like they can combine units, and with the overlap in the schedule of the lectures, that means the students will miss lectures from one unit on the other. So in terms of for the preclinical years, I mean, the course, I think the shortest period that it can go is it's 4.5 years. And correct me if I'm wrong, Dr. McGuire.
Yeah, we can't do more than one unit at a time in our preclinical program because it's already 40 hours a week. And as we said, you could not sustain that kind of pace at 80 hours a week, which is what it would take at least if you were doing 2 units at a time. It's just too intensive to be able to do that with the way that we structure that program. I would say the only place where you could shave off a little time is in the clinical transition units, because those are planned as time variable units, and they are, with the exception of the in-person week Dr. Newsom mentioned at the end of the second clinical transition unit, they're self-paced. So they are both 8 weeks of material, so 16 weeks in total, and you can take up to 32 weeks to complete them. And some students take less time to complete them. So I think the fastest completion is probably about 10 weeks so far for both C2-1 and C2-2. So it's not really, I mean, 6 weeks is a little bit of time. It's not really measurable. And sometimes students are like, oh, I wish I hadn't pushed so much to do that, because now I feel a little bit burnt out. And like, you don't want to be burnt out before you're going into clinical rotations, because you want to have all that information being bubbling up to the surface and being able to start applying it and talking about it with clinical peers and supervisors. So it's not something that we would recommend, but it is possible. And I would suggest, if those of you who have questions like Anthony about, completing things faster, to have a one-to-one conversation with our admissions counselor so you can get a better understanding of how things would fit into your personal circumstance and where you may have some flexibility and not. Let's see. Let's talk a little bit about research just briefly, because we are going to talk to Dr. Jenny in an upcoming webinar, but just because you have a history at the university of being our research director before becoming dean, students always are a little bit curious about, what it's like as a medical student to do research. So what if someone's like never done any research before? Like, do they have to complete research? Or what if people have already published research? Do they still have to complete research, and why?
So that's a good question. So research is a requirement for for everyone, regardless of their background. So we have students coming with their PhDs and 10 or 20 publication, and they're still required to do it. And now, is it scary or not? Not at all. And the reason for that is you will have support to do this researcher project. So to briefly, the researcher program is divided into 2 phases, just like what we have for your academic knowledge in medicine, the same thing for research. So you will spend your first year learning about research. What is research? How is it conducted? What are the statistical tests? How are you gonna write your manuscript? All those kind of things that you'll be taught during the first year. And then maybe we can maybe link that to the previous question that you have, or one of the students had, or the applicants. Time. That's why another reason that sometimes it's like you cannot complete those preclinical units, because research will be running along with these preclinical units. So you will pretty much running two different segments at once. Once you're done with the theories behind research, you will start your own research project. When I say research project, I'm not saying anything that is like PhD level. These are simple projects that really, again, another, think about it as an exercise. You're applying what you learned in research, and how you're gonna end up with a nice 3, 4, 5 pages of manuscript. And many students come with no research background. Um, with the support system that we have in place, including research advisors, the research department, the different platforms that they will hear from their colleague presenting a research club, the journal club that we have on weekly basis. All these will give the student an idea what is research, how is it conducted, and the end result will be a manuscript. Now, it will be really great if you have that manuscript done, or you publish that manuscript by the end of your medical education, because that's something that you can add to your resume. And given the competition in applying for internship and other job opportunities after graduation, you want to make sure that you are shining with a high pass in AMC. You have your research. We have students who are publishing 2 or 3 papers, literature review during during their medical years here at OEM. And think about a way of how you're gonna sell yourself to an internship program somewhere in your city. If you have different many qualifications, including a solid research output, that will definitely make you the best candidate for that certain position. So, in general, research is a requirement regardless of your educational or your research background. But I can assure everyone that I mean, all students are doing really great. Just like what we did with medical science, it will be commitment. You will need to do it. It's better to do it as soon as you start. Many students will always encourage students to do it while you're still in the preclinical year, because once you get into the hospital during your clinical rotations, you're going to spend maybe 40, 50 hours in your clinical site. You will have less time dedicated to research. So the more you do during your clinical years, the better the outcome, or the less hassle that you have toward the end of your journey as a medical student.
So speaking of things being good on your CV and when you're applying for internship positions, Anthony has also asked about, what's the rate of graduates that get a job in Australia after graduating from OUM? Is it easy as an IMG, an international medical graduate, to get into an internship program? Could you tell us a little bit about that?
Sure. So it is getting a job is that's the second part of your medical journey. So first part is getting into medical school, coming up with a degree, and then the second part is your internship. Internship will not rely for because we are an international medical school. You will be required to finish your AMC. The sooner you finish AMC, where our students are doing really great these days with the AMC prep program we have in place. And there is a new AMC program that is coming up and starting in 2026 that will take all students in their final year. We are making sure that students will hit AMC as soon as they graduate, so they can apply for the internship, and in the very next cycle they don't need to now cycles. The internship is going through cycles, and we're planning to have all students completing or able to sit their AMC by the time they graduate, or within 45 days after a graduation. Internship students, our students are doing really great. They're practicing and getting those, and again, that if the student is passing AMC, they have a nice resume, including a publication record. They will be able to get a job, and they're really great. I mean, I think the 2 or 3 recent graduates have able to secure in Royal Melbourne Hospital in Australia, which is really great. I mean, it's amazing a place to work in, and we have other students who are doing got jobs in Tasmania, and so yeah, it's not tough. If someone did it before you, you should be able to do it as well.
And if you're interested in talking with one of our graduates who's practicing in your state, our admissions team does keep a listing of alumni that are happy to talk with our prospective students. So I can't guarantee that every city and every state will have willing alumni to speak with you, but they'd be happy to give you someone who's close by or has at least um, done a bit of practice in your local area. So we're right on the hour. So I know that each and every one of you will join me in thanking Dr. Musin for taking some time out of his incredibly busy schedule to be here with us today and to give us a little bit more information about the standard pathway and what to expect in terms of entering medical school and going through OUM. If you have some questions that arise in the next day or so or week that we didn't get a chance to cover at the webinar, do feel free to reach out to your admissions counselor. Camille and Shanda are so lovely, and they just like, I think they know the most of anybody in the entire university about the various facets of the university. So they'll be able to answer your questions. And if you haven't chatted with them yet, I really recommend just filling out that quick information piece on the website that just says get in touch with an admissions counselor. There's no commitment related to doing that, but just gives you some access to additional information that's not present on the website. And if you haven't visited the website yet, do feel free to get some additional information about the standard pathway there, and just have a bit of an exploration to find more about our university and our community. So Ali and Amanda and Anthony and Bernard and Bruna and Shipo and Hayden and Henry, Jijo and Kanisha, Martin and Matthew, Mesh and Olu and Romani and Shani and Stephen, Uchechi, Jordanos and Zar. We're very happy to have you join us in our community today. And goodbye to each of you, and to those of you who have joined us via recording. So nice to see you as well. See you in November for our November webinar. And bye for now. Be well until then. Thanks again, Dr. Musin.
Thank you. Pleasure being here. Thank you. Bye.